the end, but it is now my very great pleasure to introduce the man on my left. Now, last year, he too was a new boy, because as the Chief Exec of the NHS Confederation, new boy, did you have to hit the ground running. There were the small matters of ongoing austerity, there was a general election to contend with, there was simmering discontent among a workforce, and then of course there was the 5-year view, the 5-year forward view to keep on track. So all of that he came into and had to run with. So Rob is going to not only look back on what the last year has been like for him, but look forward, what is it going to be like for the rest of us? Please put your hands together and welcome Rob Webster.
Thank you, Anita. So I'm a 25-year career new boy, which is a nice thing to be. And hello, my name is Rob Webster, and I am the Chief Executive of the NHS Confederation. And at the Confederation, we've got three jobs really. We're a system leader. We represent the views of our members, nearly 500 of them, and we do that with ministers, with national bodies, with the unions and in Europe. And we provide direct support to you so that you can do your job better. And it feels like it's never been a time where we needed a stronger confederation than now, and it's never felt like a better time to be coming together in Liverpool to talk about the future of the NHS. It's been a quiet week for everybody, I think, hasn't it, so far? There's not been many announcements, or nobody's received any letters from anybody. But this is the time, post-election, where we can come together and set the tone for the next year and for the next 5 years for the NHS. I think that's what we're here to do over the next 3 days. And what we'll do is we'll hear from politicians, we'll hear from the arm's length bodies, we'll hear from people like you about what we're going to do collectively to try and set a positive tone for the future, for this year and for the next 5. And I think by Friday, what people will do will come away from this saying, actually, we've got a sense of hope here because we can set the right tone. That was what we tried to do last year, and I think that's what we can do this year. Because what we've got to do is change gear. We've got the election behind us. We've moved on from the debates about what we need to do and who's going to be in charge to a position where we have to think about how are we going to achieve the challenge that's been set us. How are we collectively going to deliver the 2015 challenge in the light of some of the toughest times we've ever faced. Last year I talked about it's always a tough year in the NHS. This year's going to be tough again. And what I see, as Andrew said, is a group of leaders, of people who can inspire others to get to the position where we can deliver. And the next few days will help us to answer that question in the context of our leadership survey, which was published today. And what that said was that 81% of you believe that being a leader in the NHS now is tougher than it was a year ago. What that survey said was that 71% of you think you face the biggest financial challenge of your career. 99% of you say that social care cuts are directly impacting on your ability to deliver care. So we've got this tough context, this tough position, but I believe in that what we can do is build some optimism. Now at this point you might think I'm delusional, or you might think that I'm telling the truth, but what I'd ask you to do is just reflect on where we were this time last year. So a year ago I stood here and we just set out the declaration of the issues that were facing the NHS. We had no shared ambition or vision for the future. We had a set of arm's length bodies who were new or maturing and not working together, and Simon Stevens had just arrived. And the conversation about money was how much less we were going to get, not how much more. Now since then, what we've done as a confederation, in that environment we said, well, let's work with other representative bodies, 23 of them, to put a vision out for the future, a burning ambition for the future, to set some asks of the government and arm's length bodies to create the conditions where we can deliver, and then to push that agenda very hard. So that's what we did. Subsequently, we had the 5-year forward view, and the 5-year forward view created a consensus around a vision for the future, but for the first time, it also made some rational sense about the money, and everyone got behind it. Shortly after that, we had the Dalton Review published, which said, you don't have to be an enormous provider to survive in the future. You can be a different size and shape, but you're going to have to work together. So a new future for providers came about. We had the Autumn Statement, which gave us £2 billion of extra money recurrently now and in the future. And we had an election where we actually started to have the right sorts of conversations politically about the future of the NHS. Not the complete conversation, but we started to have the right sorts of conversations. So I think that's progress. And if you add on to it the fact that the Act became a reality and that what we saw was frontline organisations taking the responsibility for change, national bodies publishing their own plan at arm's length of government, which wasn't a white paper, and politicians starting to say, yes, we'll create the financial and political context for you to deliver. So the Act became a reality. So I think that's strategic progress by anyone's measure. Now, it would be remiss of me at this point not to mention that we've had some challenges too, and that operationally, what we've had to do and what you've had to do is deliver a huge amount. Those survey figures that I described are on the back of some fantastic work that you've done. So over the last year, we've seen more patients in hospitals than ever before. We've seen more patients within 4 hours in hospitals than ever before. We've seen 9% more people picked up by an emergency ambulance and taken to the place of need and safety than the previous year. We've seen 20% more people referred to community mental health services than 5 years ago. We've seen the second best patient and public satisfaction with the NHS ever. All of these things have been achieved by you working in an environment where the strategic and operational agenda is changing. And at the same time, we've faced some of the biggest issues that have affected us with honesty. So the Kirkup report into Morecambe Bay, the whistleblowing report by Francis, which is a stain on the leadership of the NHS, we've looked at that and said, if this is a mirror that's held up to us, we'll do something about it. Now I'm going to say something now which I don't think you get to hear often enough, and that's thank you. Thank you for doing that. Thank you for every time you've been in the emergency department at 3 o'clock in the morning during the winter. Thank you for every difficult conversation that you've had with the staff during the industrial action that you've faced. Thanks for all the brilliant innovation that I see every time I go out to the service. Thank you for the cultural changes that I'm seeing in organisations across the country. Thank you for all the relationships that you're building. Thanks for all those difficult commissioning decisions that people are making. Thanks for every reconfiguration that you've seen right through because it's better for patients. Thank you for every life that you've saved, every dignified death at home, every shred of kindness, compassion and dignity that you've offered and that your service has offered. Because what you do matters. What you do really matters, and I think you deserve a great deal of credit for what you've achieved in the last year. Now, people don't say that often enough to you, but I think that's behind one of the other really startling figures in our survey. You could look at our survey and say, this looks horrible. Yet, more than half of you would recommend a career in the NHS to your friends and your family. More than half of you. Because what we do really matters. And we need to retain our resilience and our optimism, our ambition, our pragmatism, and the reality of the issues we face so we can get on with them. Now, to do that, I think we have to have a conversation constantly about why do we do what we do. And I'm going to try an experiment now, which might be the biggest ever icebreaker we've ever had. It might be a complete, we might set a new trend. But I'm going to ask you to do something for me for 1 minute. And that is to turn to the person next to you just for 1 minute and talk to them about why do you do your job. And the minute starts now. So we've got a minute. So why do you do your job?
I think that I serve speaking to the public what the things they say mean and actually translating back what impact it's having on real lives. That's why I do it.
Fantastic.
Why do you do what you do?
I think it's taken me years to realise that I do it for 2 reasons only. And that's to make a difference to patients and see my staff do well. I think that's at the heart of it.
Yeah.
nothing more than that, really.
It's a good experiment.
Yeah, I've done it so many times with so many
It's
different
very
people.
good. It just gets people chatting to their neighbours, even wherever. It's like being in church, shaking hands with the person behind you.
That's right. Okay, so at this point it's really always very difficult to get people to be quiet, and it's particularly difficult to get chief executives, chairs, non-executives, medical directors, nurse directors and others to be quiet in this experiment, but ultimately people do. So the thing that I would say to you is how much energy was in the room then and how noisy was it? And how easy did you find that conversation? And I've done this experiment with my own staff, I've done it with chief executives, I've done it with senior leaders across the service in small groups, big groups, but never a group this size. And what normally I'd ask them to do is say, well, what did you say? Now, we haven't got time to do that in this audience within the half an hour that I've got, but I bet what you said boiled down to 5 or 6 things. I do this to make a difference to patients. I do this because it's just really, really interesting and very challenging intellectually. I do this because I love working with my team. I do this because it's a vocation and it defines me. I do this because the NHS is a moral good and it's part of society. I do this to feed my family. Now, I can see lots of people nodding and saying, yeah, that's what we were saying. Now, I've done this experiment with people across the whole service and the answers are always the same. So the drivers, the things we get out of bed for, are the same, whether you're a chief executive, a chair, a porter, a therapist, a nurse, an admin assistant, somebody who works in IT. What a great opportunity that is for us to think about harnessing the momentum and energy of everybody in the NHS. At this point, what people would normally do is say, well, JFK went to NASA and he talked to the janitor and he said he was putting a man on the moon. But I think we can do better than that. When I was a trust chief exec and I did this experiment with staff at induction, I used to be helped by this guy, Andy, who worked in HR. And the first time I did it, I said to him, so Andy, why do you do your job? And he said, I do my job because I make people better. He said, I work in HR and I help with the recruitment process and we design it so that we get the best people and we get the best people who then deliver really good care, and that matters to me because I'm from Leeds and I want people in Leeds to get great care. So I do my job because I make people better. So the job for us as leaders in this really tough context is to take the thing that gets us out of bed every day and point it at something we can all get behind. Now, the great news for us, the fantastic news for us, is we've got something. It's called the 5-year forward view and the public health priorities. We can all get behind that. Politically, nationally, locally, the 5-year forward view sets out a vision, a burning ambition for the NHS that we can all point our drivers for getting out of bed towards so that we can achieve it. And just to remind you what it says, the 5-year forward view says something that's pretty well rehearsed, really well connected back to what the 2015 challenge said the vision for the NHS was. It says, the place where you live defines how long you'll live and how well you'll be. Fact. What we need to do is make places healthier and the healthy choice the easy choice. So local government, working with its partners, has to make sure that places are healthier. And that's about education, environment, the economy, housing, and healthcare. So the duty of local government should be to make people well. And nationally, we need to support that through what we do around tobacco control, alcohol, and sugar and fats. So that's the first thing it says. It then says if you've got a long-term condition, and there are 18 million people like this, you look after yourself most of the time. So we'll help you to look after yourself by giving you great information, access to us when you need it, and services which support you. If you're one of the 3 million people we're soon going to have with 3 or more long-term conditions, we'll build the team around you. Starting with general practice, which is one of the greatest assets that we've got, we will build the team around you. So you're in it, your carer's in it, your family's in it, social care's in it, the NHS is in it, the third sector's in it. But we'll join up that care so you're well for more of the time. And the idea that you'll ever be discharged from our care is redundant because you've got a long-term relationship with us. If you need hospital care, it'll be local. It'll be networked, it'll be viable, it will provide you with great convenient services, but you may have to go further if you require something which is specialised to a fantastic, internationally renowned unit which will save your life if you have an emergency, give you great outcomes, do loads of research and be fantastic. Some of those services will be available 7 days a week because you shouldn't die on a Sunday from something you wouldn't die of on a Tuesday. And those services will be commissioned by clinicians, working with the public, using the best evidence, and taking technology and harnessing it in the way we've done in the rest of our lives to make a difference. Now, I think that's what the 5-year forward view says, and that feels like a new and better and more 21st century NHS that we could all get behind. 5-year forward view doesn't say new models of care about structure. We've got a pathological desire to talk about structure. We need to stop it. It says we've got a clinical model for the future that we can all get behind. Now, I think it's fantastic that that's the case, and I also think that we should recognise that the only way we get there is through people. The only way we get there is through people, because the NHS is made of people. It's what we invest in, it's who delivers care, it's the thing that defines us. So we have to work through people, which means it's a leadership challenge. And the fact we have a shared ambition and a burning ambition, and the fact that we have drivers that get people out of bed that are shared, that gives us the opportunity. So you need to lead your people with you in the system, in your organisations, towards the 5-year forward view. Now, as Chief Exec of the Confederation, one of the biggest things for me has been, that's a deal that we have to have with frontline organisations, the national system, and the politicians, all pulling in the same direction. And we've said in the 2015 challenge, if you create the conditions, we will deliver. And if you don't, we can't. And that's still the situation today. And over the next 3 days, the question we've got to ask ourselves is, do we have a deal? And there's a good chance that we will have a deal where we can deliver because the conditions are right. The conditions for you are right in your localities. Now, for me, it comes down to 4 things that we obsess about constantly, and we keep checking back about, as are we on the right track? Are we getting the right support from national bodies, from politicians on? And the first of these is the money. The first is the money. Let's talk about the money to get it out of the way. Because the whole of the election campaign and the conversations about the NHS default to the money. And what we're in danger of doing is letting the money be the servant, of everything being the servant of the money. So quality service becomes the servant of the money. What we need to do is make the money the servant of quality and of care. So all the conversations we have around what kind of care and what quality we're going to achieve with the money that we've got. And how does the money support that? And at the Confederation, we've got a very simple set of asks about the money. Be clear about how much we've got each year, how it's going to be phased over the next 5 years. Make sure you fund social care. Make sure that there's funding for change, because change costs money. And let's think about the incentives and the balance of risk in the system. Every time I go out, whether from Bolton to Basingstoke, from Barrow to Bridgend, it's always the same kind of conversation. The balance of risk and incentive isn't right. So we need to change that. So 4 quite simple things, and some of those are in the bag. We know that the gap between what we've got at the moment and what we'll have in the future is about 30 billion in the NHS. And we should be grateful, genuinely grateful, that politicians in an environment of austerity have said that we'll put some money into the NHS. We will put 8 billion more into the NHS over the next 5 years. Because if you look around the rest of the public sector, that really isn't the case. That really isn't the case. So I think closing that 30 billion gap, part of that will be closed through income, the rest will be closed through efficiency and productivity. And we know that that 22 billion is probably greater than 22 because the social care funding gap is 4 billion plus. So the challenge for us is, can we do it? Is it possible? And how do we get there? Now, in the past, I've got direct experience of this, having worked in the Department of Health. What we'd have done is get some people in Richmond House to come up with a spreadsheet that says, yes, we can do it, and here's the answer. That doesn't work. What I'm delighted to tell you all today is that we'll be working as the Confederation with the arm's length bodies over the next 4 months to say, how are we actually going to deliver this 22 billion? So you will be invited to get involved in a programme of work to say, what does this plan look like? How is it achieved so that we can deliver this year and for the next 5? So we have something that's practical, realistic and achievable. Simon's going to talk a lot more about this, so I won't talk about it anymore. So that's our first obsession. Let's be honest about the money. Let's be clear about the money so we can plan for the future. The second obsession is about the workforce. Every visit I go on, every chief executive I talk to, workforce is the issue that's front and centre for them. Workforce is the issue that's front and centre for them. And the big news this week is we spend too much on agency staff. And I think there are 2 issues why that's the case. The first is there's a misalignment between policy, service, financial planning and workforce planning. So we've ended up in a short-term bind where we don't have enough staff to fill the rotas that we need to. The second is a cultural one. I think we've lost the social contract with some staff. I think we've lost the social contract with some staff. I think it's anathema to some staff. It would have been in my career, I'm sure many of you feel the same. I can't imagine a time in the past where staff would have worked 3 days in their organisation, gone to work for an agency back in their own organisation at a significantly higher rate, and seen the impact it had on their colleagues and the organisation. I think they would have said it doesn't feel right. The fact that that happens constantly is a worry. So I think we've got to do 2 things on the workforce. We've got to align the workforce planning and the supply of workforce to meet future demand with a new type of workforce, and we've got to sort out the culture. I think the first of those we can get right. We've got HEE today, we've got a big session this afternoon on the workforce. We've had a workforce summit with all the HR directors this morning talking about these issues. The second, I think, requires us to really rebuild the commitment that we've got with staff, to really make them feel like we mean it when we say that they're our biggest asset, they're our biggest investment. They're the people who really make a difference. Because when it comes down to it, we've got a simple task. Somebody needs help, somebody can give it to them, and we bring them together. Now, if we're really going to support our staff, I think that we've got some things to do. So the first is to think about pay. Maslow said quite famously that pay can only disincentivise. And we've got to ask ourselves, does pay disincentivise or incentivise at the moment in the NHS? How do we, in the medium term, come out of pay restraint so that we can reward staff appropriately? And how do we get contractual reform in place which allows that to be affordable? 2 big challenges for us. Once we get that out of the way, we need to get staff feeling that we're a flexible employer, a good employer, and what they get is a good deal. That will make a really big difference. If we get it wrong, we see the consequences. When the culture's not right, we see the consequences. What we get is discrimination, equality and diversity not being addressed properly. We get Morecambe Bay, we get whistleblowing issues, we get Francis. When we get it right, you get better care for patients and better outcomes for staff. And you might believe this in your hearts like I do, but the evidence is there too. So what we need to recognise is that staff are our biggest asset and our biggest investment, and they need to be reconnected with the social contract with us as an employer so that they can get on with delivering care differently. And if we can do that for frontline staff, admin staff, clinical staff doing commissioning, all of their support, we will get a better health service. And even better, if we can do that with them in a team, where they're in a real team, you will have fewer incidents, less staff stress, and better quality care. So this is work done by Michael West, which shows that if you are in a team that can answer 3 easy questions, do you have to work together to deliver your goal? Have you written down some shared objectives? Do you meet to talk about how you're getting on? If you can say yes to those 3 things, which is a real team, you have fewer incidents, less staff stress, less error. If you answer no to any of those questions, it's worse than working on your own. If you don't do anything with my speech today, if you don't listen to anything that I've got to say, but remember one thing, I'd remember that. If you go back to your organisations and say, do we work in real teams where we can answer those 3 questions, we will save some lives and we will make staff feel better. I'm really delighted that the Workforce Advisory Board nationally is tackling these issues. I'm delighted that the HR directors have come together to talk about them too. So that's our second obsession. So if we have the right motivations, a shared ambition, get the money right and think about the workforce, then the biggest untapped resource that we have are the people we serve. We need a new deal with the public about how they access care, how they're involved in decision making, how we co-produce things together. From OneLess over 10 years ago to the 5-year forward view, there's a constant refrain that says if we do that, what we'll do is not only deliver care that's better for them, but we'll also get better outcomes, better quality of life. And we need to support this in everything that we do. Every commissioning decision should include what does this mean for the patient and how they're being involved in creating the service. And this will be a big theme of the conference. On all of my visits out and about, whether it's to look at Move More Sheffield or the Halton community practices, where this has worked, we've seen significant improvements in turning the demand curve for the NHS. And we have to get real about this and prevention. I know Simon will talk a lot about this. We have to do that locally because the local conversations about local culture are really important in this sphere. If you go to Penwith in the southwest, one of the pioneers, what you see is that there are 620 voluntary organisations serving 65,000 people. And the pioneer has worked with them to say, what could we do to help local people feel less isolated and lonely? So they've created things like knitting and natter. So you and your friends can go to the cafe, have a chat, do some knitting, bond together, start to develop a combat against loneliness and isolation. They've got the same thing in Runcorn, but it's called Stitch and Bitch. We need to recognise that these things need to be communicated in ways which engage the public and make a difference. So we need to do this. This needs to be a social movement that changes the way things are. So the fourth and final obsession that we've got really, I think, is critical to all of the above. And it's about how do we all work together to create a system that is going to actually achieve what we need for patients. Because at the moment, what we've got, I think, is a political, an arm's length body of national bodies system and a frontline system which isn't quite there. It's getting there, but not quite. Too often, in a system where we are £822 million adrift of the financial balance we require in the provider sector, in a broken system, what I see is people criticised for a broken system. I see people being undermined by the system where they need support, they get censure. We can't have it. We can't have it anymore. We need to change the relationships between the politics, the arm's length bodies and the frontline organisations. And I think it's fundamentally changing. I think you can make your own mind up this week, but I think it's changing. And the green shoots on this, I think, are that the political will and the financial backing for the 5-year forward view, I think it's there, and I think Jeremy will talk about this week. I think we'll see a changed narrative. The arm's length bodies are working together, and what you said in our survey was the arm's length bodies need to work together. 90-odd% of you said the arm's length bodies need to work together to support us. We can't have an epidemic of assurance stopping us from delivering. Nigel's looking now because he told me this morning. We can't have an epidemic of assurance getting in the way of people delivering care. But I think we are seeing a change to that. The arm's length bodies are working together to obviously the delivery of the 5-year forward view. They want to work with us as partners in its delivery because they see the co-production of it will make the biggest difference. And overwhelmingly, what you said is the politicians need to be honest with the public about the changes that we will have to implement if we're going to have a sustainable future for health and care. Now, as I said, I think the proof of the pudding will be in the eating. We are seeing some green shoots. We're also seeing some things which look more difficult. So if you've had some letters this week, they might have caused a certain response when you read them. But what we really need to do is to make sure that we get there. The final thing then I wanted to talk about was, do we have a real team? If in that environment, if we've got a common set of drivers for what we want to do, if we have a common ambition that's burning, that connects us all, if we have the right conversation about the money, the workforce, working with the public and to deal with them, if we have the right arrangements between ourselves, have we got a real team to deliver all of that? Because remember, Michael West says a real team has to work together to deliver its objectives, has written its objectives down and works together to talk about how it's getting on. If we can have that real team, then the biggest challenge left is for you. The biggest challenge left is for you and for me as a leader. And for those of you who were here last year, you'll know that I asked one of our patients, Adam Bajelian, to write what he thought the best description and definition was of a leader in the NHS. And Adam wrote a poem for us, and I'm going to read it again because I like to be consistent. And what he said was, if you want to be a leader in the NHS, then the attributes that you have are these. So this rhyme is a puzzle, as you will see. This rhyme tells what a good leader should be. A good leader respects the young and the old. A good leader observes and is prepared to be bold. A good leader is brave and will try something new. A good leader works hard and gives praise when it's due. A good leader expects the best from all staff. A good leader brings happiness and shares in a laugh. A good leader supports patients and gives them the best. A good leader teaches staff to be ahead of the rest. A good leader explains if something goes amiss. A good leader rejoices in times of great bliss. If you study this rhyme and look very close, you'll discover the leader I admire most. And having that written by a 15-year-old patient who'd spent half his life in hospital, I thought was really insightful. And it was a very clever poem because it challenges the reader. It says, are you this good? And for those of you who know the story, it's a real challenge to me because Adam used my name down the middle of the poem to express the real attributes that he thought people needed to bring. So for us as leaders, what we need to ask ourselves is, are we the ones who are describing the way in which we're going to take the people who we work with that can give somebody help and work with the people who need the help and create the conditions where we bring them together in the most effective way to deliver the best outcomes? And as the Chief Exec of the Confederation, my job, I think, is to make sure that we keep obsessing about the things with the national bodies and the politicians which allow you to do your job out there. And this is really important, isn't it? So if we go back to what drives us, and why we get out of bed every morning, people often talk about 6 degrees of separation between you and anything else in the world. With the NHS, it's not like that, is it? There aren't really 6 degrees of separation because we're all patients. We're all carers. We all know somebody who is older or an older carer. We all have families. You know, we all know somebody with a mental health problem. We all know a child with an educational need or an ongoing learning disability. You know, there aren't 6 degrees of separation in the NHS. It's part of all of our lives, and that's why it touches us in such a special way. You know, I'm the son of a father with Alzheimer's. You know, my mum's 71, she's his main carer. I'm the brother of someone who committed suicide at 32. I'm the dad of someone with a learning disability. And I'm saying that because you in the audience, us as leaders, we often have this disconnect between us as leaders in the NHS, us as patients, us as people. And over the next 3 days, as we listen to patient leaders, as we listen to local government leaders, as we listen to NHS leaders, I think the artificial walls and boundaries between those things, that cognitive dissonance between them, needs to be swept away, because what we're going to need is every ounce of resilience and the efforts of 1.4 million NHS staff, 1.6 million care staff, 3 million volunteers, 6 million carers, if we're going to protect and nurture the health and care system to deliver the burning ambition that we've got for it. Our survey tells us we can make the improvements to the system with the right conditions and with the right backing. And that'll be down to you and your local leadership. And over the next 3 days, you know, we'll set the tone for the next year and maybe the next 5 about how this becomes a reality. How only we can truly drive the improvements to care that will see us retain the NHS as the envy of the world and a 21st century world leader in innovation and care. Thank you very much.